Good afternoon, and thank you for joining us for our weekly update. I want to start off by recognizing that it's National Public Works Week. Thanks to our work staff, many who are essential workers, who throughout this pandemic have been repairing our roads, maintaining our facilities, and keeping our city clean. All the things that ensure Mississauga remains a great city to live in, thank you for all that you do. I also want to recognize that it was Personal Support Worker Day earlier this week, and I want to thank the thousands of PSWs across our city, especially those who work in long-term care homes, who have stepped up in a big way during this crisis. Many families who are unable to see their loved ones find solace in knowing that they're being provided quality care by the PSWs. They are our unsung heroes. Today I am joined by Dr. Lawrence Lowe, our Peel Medical Officer of Health, and Sherry Lichterman, our Commissioner for Community Services. We are now in week 10 of this pandemic, and while we are making meaningful progress, we know that community spread is still happening here in Peel. Much like the province did yesterday, we too are seeing cases go up and down, but for the most part, the overall trend is pointing downwards. We reported 226 new cases in Peel in the last 72 hours. Nearly 1/4 of all new cases in the province in the last week were reported here in Peel. And over 60% of all cases are in the GTA. The bottom line is that our job is not done yet. While we may be done with COVID, it is not yet done with us. I know we're all eager to see our families, hug our loved ones, and get back to our workplaces, and generally just get life back to normal, but we need to take things slow and steady. We simply cannot afford a second wave. As restrictions are eased, we begin to see the slow reopening and can't lose sight of what we are dealing with. COVID-19 is 10 times more contagious than the flu. It can take 2 weeks for the virus to present itself, and some people will display no symptoms at all. Until we have a reliable vaccine, we will have to accept that COVID will be part of our daily lives, and we will need to take precautions. As we work to roll out phase 1 of the province's reopening, we need to closely monitor case rates to ensure that we don't backslide. If we do, we will have to carefully reconsider these openings. And while I appreciate the provinces extending the state of emergency until the end of the month, it is certainly the right thing to do, and we cannot let our guard down. I can't emphasize enough that cities need a sufficient heads up on the details of what is included in each of the reopening phases so that we can make the decisions that reflect our local realities and so that we can plan accordingly. When these announcements are made public, it creates an expectation that the reopenings can happen overnight, but they can't. We have seen many retail businesses who have been given the green light to reopen their doors, but they simply aren't ready because it takes time, thought, and resources to ensure that they comply with the new guidelines. When cities find out about additional openings at the same time as the public, it creates some real challenges for us. We were working through the province's list of openings announced last Thursday when more facilities were added to the list just yesterday morning. We are the ones who operate the facilities and undertake the enforcement of the rules. It is important that we know what's coming. We know residents want to get out and fully enjoy the parks again, and we will reopen those amenities listed by the province slowly, carefully, and thoughtfully. Your health and safety is our top priority. While we wish reopening was as simple as taking off the locks, it is not. Our new normal will require new guidelines around how residents can enjoy our amenities, especially in our parks. Last weekend, we were able to open the first of our 2 city-owned golf courses because we had advance notice and sufficient time to prepare the course, get the staffing in place, and implement enhanced health and safety measures like plexiglass barriers, staggered tee times, and proper signage. Our second golf course, Lakeview, will open tomorrow. And this weekend, we will begin gradual reopening of our marinas. Boaters with a slip will be contacted by marina staff to schedule a time for their launch. Our public boat launch at Lakefront Promenade will also, weather permitting, open this weekend. The work to reopen our 9 community gardens this Friday was already underway and will proceed as planned. But we need to give the same amount of care and consideration to how our other facilities and amenities are reopened. That means deploying and training staff on updated health and safety guidelines, updating signage, and properly retrofitting amenities where needed. It took us 2 weeks to fully close down our facilities at the beginning of the pandemic. They cannot be reopened overnight. It is better to be safe than sorry. There have been a lot of changes over the past few months, and proper education will be the key. We don't want to create any unnecessary confusion with our residents on what's open, what's not, and how they can use our facilities. We also know that community spread is still happening here in Peel, and that our numbers right now in terms of new cases simply do not support broader reopening at this time. Which is why, after consultation with our Chief Medical Officer of Health, the CEO of Trillium Health Partners, Michelle D'Emmanuel, and our Council, we have decided to take a slower, more cautious approach to the province's reopening timelines. We must listen to the experts. Our approach will be reasonable, thoughtful, and it will be measured. It will be guided by local data and science. We cannot lose the gains that we've made in the past 10 weeks. Ours will be a made-in-Mississauga approach, an asymmetrical approach, a regional approach. We will divide our reopening into phases based on the best advice of our Peel Medical Health Officer. We've asked Dr. Lowe to work with our team in the coming days to review our plan and to come to our council meeting next week. This will allow us more time to gather data and understand the picture of the virus here in Peel. We know a lot can change in 1 week, and our approach will be flexible, but our decisions will be based on data and evidence. In the meantime, staff will start preparing for reopening, including developing signage and consulting with sports groups to make sure that we do what is right. This means, for now, things will remain the status quo here in Mississauga. Our leash-free dog parks, public and community tennis courts, skate parks, park benches, picnic benches, our sports field, soccer and baseball fields, our courts including basketball and bocce, will remain closed for now. The Premier conceded that different parts of the province are in different phases of the pandemic. He's allowed us the power to make local decisions. We're making decisions in the best interests of public health and for our residents. I know many parents are anxious for an update on summer camps. Our staff are also busy getting ready to make some changes to our city-run day camps, should the province allow them to reopen for July and August. I will have more detail to provide to you on this in the weeks to come. In the meantime, my message to residents remains unchanged. Please be smart, be responsible, use your common sense. Keep your distance at all times, stay local as much as possible, and stay apart. When you do head out, think about whether or not you really need to go out. We will continue to have a team of 185 officers on the ground to ensure that people understand and that are following the rules. Restrictions on gathering of over 5 people who are not from the same household are still in effect, as is maintaining 2 meters or 6 feet distance at all times. We can't afford a second wave. We aren't through the first one. I will now turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on Peel Region's response to the virus. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of this afternoon, we have 1,876 cases of COVID-19 in Mississauga. 1,333 of those have recovered, and 171 of those have passed away. Throughout this crisis, I have been in constant contact with colleagues across the country. One jurisdiction that I have been in contact with is British Columbia, where I previously worked. I believe that British Columbia's proximity to Washington State likely played a role as to why they saw COVID-19 earlier than the rest of us in Canada. It also explains in part where they might be in the epidemic curve relative to us in Ontario. I noted that among the things that are permitted to reopen in British Columbia's Phase 2 restart include the retail sector, health services, parks, beaches, and outdoor spaces, as well as recreational and sports facilities. If that sounds familiar, those are the same openings that have just been announced in Phase 1 in Ontario. By comparison, nearly 1 in 5 British Columbians live in the cities of Vancouver and Richmond, 900,000 people spread over 240 square kilometers. That is comparable to Mississauga, where we have 830,000 residents over 292 square kilometers. Vancouver Coastal Health Authority, which serves those cities that I mentioned in BC, reported 3 new cases of COVID-19 yesterday and has seen a week with no or single daily digit increases. By contrast, our past week here in Mississauga has seen nearly 200 new cases, dozens a day, and across the border, Toronto continues to see hundreds of cases a day. That's as many as Fraser Health Authority, which sits across the boundary road from Vancouver Coastal, has seen in 2 weeks. I also understand from Michelle D'Emmanuel, CEO at Trillium Health Partners, that their hospital continues to operate at over 90% capacity while still caring for over 100 COVID patients at their sites, with many in intensive care. Now, this is not to compare the actions that have been taken by my colleagues in BC. Both here and there, health professionals have worked tirelessly to bring under control the different hands that COVID-19 has dealt. I am actually simply comparing the pandemic picture. It is clear that the Lower Mainland in British Columbia and the Greater Toronto Area are in very different places in the COVID-19 pandemic curve. Yet somehow, in the region of Peel and the GTA, we are being asked to reopen on the same timeline. You have heard my recent message in weeks turn to a cautious optimism that we are chasing the plateau. That optimism is cautious. The fire is under control, the fire is coming under control, but it is not fully under control. And while getting outdoors is a crucial next step, an immediate mass reopening of the facilities announced yesterday would, in my opinion, be a mistake. It is for this reason that I recommended to our local municipalities that they hold off opening any outdoor amenities until after Monday, May 25th, among those stated in the order received yesterday, and possibly later as our numbers dictate. I've also asked, and it has been accepted, that we will work together to develop a staged plan for the safe and careful reopening of these facilities in Mississauga and throughout the region of Peel. We also continue to monitor for daily increased declines that meet the criteria set out in the province of Ontario's own framework for reopening around viral spread and containment, as well as around capacity for testing, tracing, and treating those who fall sick. Now, I know the weather is getting nice, and so I still encourage you to go out, but stay close to home. Use sidewalks, active transport corridors, backyards, and common spaces and complexes to get some exercise and fresh air this weekend. And while you're doing so, do your part and stay 2 meters apart, and wear a non-medical mask where you can't, like in grocery stores or on transit. Enjoy this nice weekend close to home, because if we get this right, we'll hopefully be able to enjoy many more summer weekends outside, just a while longer. Thank you.
Thank you, Dr. Lowe. I want to close once again by thanking our frontline and our essential workers for their service. They're our true heroes in our community. I also want to thank our residents for your patience and your understanding. I know this hasn't been easy. You've done your civic duty, and we ask that you continue to do so for a few weeks and perhaps a few months more. We all have a role to play here. We are all eager to get things back to normal, but we need to do it when and where it's safe and it makes sense. Dr. Lowe and his fellow GTA public health units will closely monitor case rates over the next few weeks and are working on enhanced matrix, and that will talk about how this pandemic projecting is above and beyond just the case counts. There's more to it. We also look forward to Dr. Lowe's professional advice and presentation to our council next Wednesday. We want to ensure that as we move forward, we never once look back. We must not lose sight of our common goal to keep our city healthy and safe and to ensure that we never have to do this again. Let's get it right the first time. No one wants to reopen only to have to close again mid-summer and lose all the gains that we have made. Thank you, and I'm now prepared to take questions from the media.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie. My question is actually about restaurants. I know that recently the City of Toronto said that they're going to look into expanding patio space when possible so that restaurants can have more room to allow patrons to socially distance outside. I was wondering if Mississauga has any plans to do the same so that when restaurants do eventually reopen, they will potentially have more outdoor space to work with.
Ashley, it's an excellent question. And yes, of course, we're in favor of expanded space, especially in the exterior on the patios. There's nothing anyone enjoys more. However, we have to do it when the time is right. Perhaps I'll allow Dr. Lowe to comment on the topic as well.
Thanks, Ashley. It's a great question. Certainly, we continue to monitor evidence and data from other jurisdictions that have gone before us and have looked at increasing outdoor seating in those areas. Certainly, we will continue to take our cues from the province. The more important thing is that here at Peel Public Health, our focus is on thresholds around data that indicate both our readiness to reopen in terms of capacity around testing, tracing, and treating, and also our overall trend in terms of viral spread and containment. And that will basically dictate whether whatever reopenings are announced, be it restaurants or otherwise, are in line with the picture that we see in our community. So thank you for the question. I'll pass it back to the Mayor.
So my second question is actually for Dr. Lowe.
Oh, okay.
Sorry to make you walk away.
It's all right. We're practicing strict social distancing.
That's good. So just now you mentioned that, Ontario is at a very different place than BC, that Ontario and Peel in particular is seeing a lot more cases than we're seeing in BC, yet we're kind of on the same reopening timeline. I was just wondering, why do you think that, you did mention that Vancouver's proximity to Washington might be why they're further ahead of us in their outbreak, but I wondered, why do you think the situations in the two provinces are so different, and where is the community spread in Mississauga coming from, do you think?
Thanks, Ashley. It's a great question. I'll answer your first question, your second question first. It really speaks to the need for us to actually fall in line with the broader provincial testing that has been announced. And certainly the criteria has changed. If individuals have symptoms consistent with COVID-19, they are encouraged to attend at an assessment center because we, now that the focus on long-term care homes has been largely completed, our focus is now really in trying to identify as many chains of transmission as we can in the community and making sure that those are stamped out and broken. So we do have certainly people in the community that are identified, and those chains are being worked up on, and we would certainly welcome the community's help. If you're not feeling well with COVID, please self-isolate, but ensure that you get tested. In respect to the question around BC versus Ontario, again, as I said, a lot of it has to do with when community transmission was established in these jurisdictions. And as you know, at least I think it's been widely reported, they share a significant border with Washington State, which was the first place in the United States that actually developed a significant outbreak. So I got to believe that that had some role to play in terms of seeding, given the regular integration between Seattle and Vancouver. So thank you very much for the question.
Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hey, Mayor Crombie. My questions are about summer camps, and I know you've mentioned that information will be forthcoming in the next few weeks, but summer camps are something that parents can obviously decide on the night before. They need as much warning as possible. So I was hoping you could give me an overview of where we're at with that and how the strategy will be communicated to parents so they can plan for them.
So as far as I know, we're taking our cue and our advice from the province. Schools have been closed, overnight camps have been closed, and we're waiting for signals on day camps. So far, we're waiting to get a cue from them whether July or August we are able to open our summer camps. But at this point, Isaac, we don't know yet.
Dr. Lowe, please.
Dr. Lowe.
Hi, Isaac. Go ahead with your question.
Hey, my second question is around if the province was to give the green light and we were to hit stage 2. Yesterday, they made it clear that it was the local public health units who will have the final say on whether or not to allow those day camps to go ahead, which would make you the kind of final decider on that. I was wondering what your thresholds and red lines would be for allowing day camps to open in Mississauga.
Yeah, so as I believe Mayor Crombie may have mentioned, and I believe I mentioned in my remarks as well, we continue to explore various metrics and indicators. There is a more enhanced framework for tracking that is based on the province's framework that we at Peel are actively looking at implementing, and I hope to have more details for you in the coming days on that. We're actively in discussion with our other health unit partners to see what makes sense in terms of going forward. But certainly anything we do would be in consultation and in consultation with our health units on those thresholds and in line with evidence and best evidence and data that we can around those venues. So stay tuned, Isaac. Thank you.
Okay.
Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie.
Hey, Steve.
Just a few questions about enforcement. I guess a few weeks back you'd mentioned that the importance of doing the regional approach at GTA kind of reopening, but now that kind of different facilities are open in Brampton and Mississauga and in Toronto at the same time, like, can you first comment just on whether there's challenges in enforcement now that are new, and secondly, will Mississauga change enforcement practices based on what's open now?
So between Region of Peel, Brampton, Mississauga, we have tried to align our openings as consistently as possible. We are taking the approach going forward of using our bylaw enforcement officers as an opportunity to educate people more so than write those $750 tickets. We have seen a few of them. I will share with you. We have written 143 tickets, 6 of them in the past 24 hours. The new tickets, for the most part, have been as a result of PPE littering, 6 new tickets in PPE littering. There have been some public complaints, but upon investigation, the people had dispersed or by law took the opportunity to educate those individuals on why they were breaching guidelines.
And just to follow up there very quickly, if I can. Some councillors, especially in the southern part of Mississauga, have voiced concerns about the crowds gathering near the waterfront. Are there more measures that are going to be used there to control the crowds, or is the city kind of had a harder time enforcing?
So you certainly saw the discussion this morning, rather, on whether or not we open parking lots, and we just feel it's too soon. It encourages people to gather in our parks and on our streets. As you saw the last weekend on that beautiful, sunny, warm Saturday, we issued 75 parking tickets as a result of illegal parking, and we will continue to do so when necessary. It's just not the right time to open our parking lots just yet, and that was evident from our discussion today. And even if we had lessened we had lowered the requirements in the south of Mississauga and allowed some portions of our parking lots to open because we know that we do draw crowds down there, that would only attract more crowds, as people would soon learn that while other parks and destinations are closed, the parking lots in the south would be open and a greater opportunity to flock to the waterfront. And so that's why we've been asking people to stay local. If you want to go out and take a walk, do so in your own communities.
Mayor Crombie, your next question comes from Ashwari from Red FM. Ashwari, please go ahead. Are you there, Ashwari? Okay, we'll go to the next question. The next question is from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Mayor. Canada Day celebration will be virtual this year. Can you please update us on how it would be? Because it would be really different this year.
Yes, unfortunately, we won't be celebrating Canada Day the usual way. However, we will make the best of the circumstances. And much like you have seen the Canadian concert called Come Together, we've done one locally in Mississauga called Rise Up, where we have a lot of local talent performing. We have the councillors engaged, sites and and scenes from around Mississauga. We'll have the opportunity to capture some of our residents, and we'll have contests, etc. We will make it as exciting as we possibly can. It will be recorded so that people can either watch it live or turn it on afterwards. If it's a nice, bright, sunny day, they may be out in their backyards, so they can watch it in the evening. We will be doing a live show for our residents on Canada Day.
Thank you. Dr. Low, please.
Online. Dr. Low?
Hi, yes.
Dr. Low, earlier today you attended the daily briefing with the Brampton Mayor. Can you please update us on the capacity of hospitals in both Mississauga and Brampton, and which facilities are near capacity when it comes to COVID, please?
Thanks very much for the question. I understand that both hospitals have COVID patients and that they are operating at very high capacity. Because I don't operate the hospitals directly, I don't have the specific numbers available beyond what I provided in my remarks, but I would encourage you, if you have questions about hospital capacity, to certainly reach out to the hospitals, and they do have dashboards online that can speak to that. I think the more important message that I would have is, as I understand from our hospital partners, we are still treating many COVID patients in our hospital system, which to me, at least from the broader view at the community level, suggests to me that we're not fully out of the woods yet. Thank you for the question.
Crombie, we're going to go back and try Ashwari one more time from Red FM, and this will be your last question. Please go ahead.
Mayor Crombie, cities, can you hear me this time?
Yes, we can. Thank you.
Oh, great. Hi, Mayor. Cities around the world, including Toronto, are looking at this pandemic as a once-in-a-lifetime opportunity to replan the city's infrastructure. The plan is to have more cyclists and pedestrian-friendly roads, thus moving away from the 4+ wheeler-centric layout. So has the city of Mississauga also considered infrastructural changes along these lines to ensure physical distancing?
Yes, in fact, we have, and we do have, we have closed some roads around Erin Mills, Glen Erin streets to allow for more active transportation and cycling routes. We have asked our transportation and works department to look more carefully at other routes that can be closed off, so we can allow our residents to enjoy the comforts of cycling or active transportation on our streets, which aren't busy.
Okay, thank you. My next question is for Dr. Low.
Hi there, thanks.
Hi, Dr. Low, I would like to ask you about contact tracing. So contact tracing is said to be crucial in reducing the spread of COVID-19. So how are we implementing this process in Mississauga?
Yeah, no, thank you for the question. So contact tracing is bread and butter public health. And in fact, we have been doing contact tracing since January 23rd, when we went into emergency operations. We had been prepared. And then since March 5th, when we had our first case in Peel, we immediately initiated contact tracing. What it involves is you actually try to identify the exposure. So where the person may have contracted the disease from, you manage the case, which is the individual, to make sure that they're well through the course of the disease and that they're appropriately isolated. And then you essentially try to find all the contacts, which is the contact tracing part of it, where you're essentially trying to identify anyone that they have made close contact with and advise those people to get tested and to self-isolate. So it is something that we are, that every public health agency in the world does, and really what we need to do, especially with a pandemic of this size, is to scale it up to address the large number of cases that we have seen and are continuing to see every day in the Greater Toronto Area and in Peel. Thank you for the question.
Thank you, Dr. Low and Mayor Crombie. That's all the questions for today. So this concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our media team will be sharing a link to the video of today's press conference with you shortly. Have a great day and stay well. Thanks for joining.
Thanks, sir. Thank you very much.